So this is the flower petal technique, Dr. Neha Dolakia, Mumbai. During COVID especially, we got a lot of hard cataracts post-COVID as patients had waited. Many of us have been through this step where we try to separate the posterior plate of a hard cataract and just can't proceed. So this is a technique I have devised for the same. This is a hard cataract, and I like to do the rhexis from both sides so that the pressures are balanced on both sides and one is likely to get a better rhexis. Now we know about the horizontal chop and the vertical chop. So here I am performing a vertical chop where with my right hand the phaco is holding the cataract piece and moving it upwards towards the cornea, and the left hand is moving it away horizontally and pushing it downwards towards the PC. So both the instruments are moving away from each other, and this is what we normally do. But there is a difference. I am not trying to separate it right up to the center, if you can see. I'm just going comfortably in the mid-periphery and separating just as much as I can. I'm not going below the capsule to create a horizontal chop. I'm just doing a vertical chop, but not right up to the center, because that's the part which is difficult to crack. Now instead of just sticking to one instrument, which was a sharp chopper, I'm going in with a second instrument, which is the Siebel's horizontal chopper. What I have done is made the inner surface sharp like a sickle, and therefore now I go in with the second instrument with the inner surface sharper, but the tip is a ball, and instead of going from anterior to posterior, I'm going behind the piece and cutting it in the mid periphery. I'm going behind the piece and not cutting it in the center, but I'm cutting it here. Usually we cut it right up to the center, but this central plate is what is difficult to crack. In doing so, the pieces that I get are softer, so they don't even block the phaco probe, and the central plate stays intact, which actually acts like a scaffold, preventing PC rupture. I am not cutting it like a pizza, but instead cutting it at the mid periphery, going below the phaco fragment rather than going from anteriorly towards the posterior capsule. I'm going from behind the piece and bringing it up towards me. This is the trick that I use, because many times if you try to separate it from anterior to posterior, it will not separate. But going in the reverse way and having a sharp edge in the Siebel's chopper, which I got a little modified, it helps cut the capsule. You can see the central plate is intact when I was rotating it. I again go in, go between the gap and go behind the pieces and bring out the Siebel's chopper anteriorly. Once again, the same technique, don't change anything. My central plate is intact, preventing and protecting the PC. So I'm cutting it like a flower, or how we pluck petals, rather than cutting it like a pizza. Now this is the central plate, which was very difficult. As you see, it's not been separated into 6 parts, but I eat it up as a whole, or I emulsify it as a whole. This makes hard cataracts extremely easy for anybody to do. Once again, repeating the technique, go behind the piece, bring it out anteriorly. Go behind the piece and bring it out anteriorly. Thank you so much for watching. Hope it helps many.